The numbers of new COVID-19 cases are falling in many parts of the United States. Now we need to ask ourselves, how can we get our society back to normal as safely as possible? One thought is to allow low-risk people to get back out there while protecting the most vulnerable. So far, we've been reassured that children are low risk. But is that really true? Doctors in Europe and America are now seeing a new phenomenon occurring in children called multisystem inflammatory syndrome. So as we look to get people back out into society, we need to ask ourselves, how safe is it for children? By the end of this video, we're going to answer the following questions. What is the overall risk of COVID-19 to children? What can we learn from children who got COVID-19? And lastly, what is multisystem inflammatory syndrome? In the last section, we'll discuss why the syndrome is being compared to Kawasaki disease and toxic shock syndrome. You can download this drawing I've made as a JPEG or a PDF by clicking the description below. Also, you can find the timestamps for each section of this video and the sources I've used in the description below. And if you find this video helpful, please make sure to share it with your friends and family, and make sure to hit the like button. It will help other people find this video. Starting off with our first question, what is the overall risk of COVID-19 in children? The pediatric population appears to be affected in much smaller numbers than adults. In an analysis of nearly 50,000 people in China, people under the age of 20 represented only 2% of all cases, and most of the children who did get COVID-19 only had a mild version of the disease. Thus far, we think children's role during this pandemic has been of spreading the virus rather than having severe disease. However, the information we have about children who get severely ill is extremely limited. And if we're going to be making decisions about how to reopen society safely, we should be doing so with the most information possible. Which brings us to question number 2. Question number 2, what can we learn about children who got COVID-19? Let's take a look at a soon-to-be published analysis of 177 pediatric and young adult patients in the Washington, D.C. metro area. Let's first look at the total number of people the authors of this paper analyzed. There was a total of 177 patients. 133 patients, or 75% of the total, didn't need to go to the hospital, compared to 44 patients who were hospitalized. Of the 44 patients who were hospitalized, 9 were critically ill and needed to be in the intensive care unit. When we analyze the ages of these patients, we see that all age groups were infected similarly with the virus. However, the youngest, meaning infants less than 1 year old, and the oldest, meaning adolescents and young adults, were more likely to be hospitalized. 40% of all the patients had underlying medical conditions, and those with underlying conditions were more likely to be hospitalized. What conditions did these patients have? The most common by far was asthma. However, patients with asthma were not hospitalized or critically ill more often, suggesting that coronavirus infections may cause asthma exacerbations, but not necessarily severe disease requiring hospitalization. The underlying conditions that were more common in the hospitalized group were conditions of the brain, heart, blood, and cancer. There were 9 patients who had to go to the intensive care unit due to critical illness. 8 out of the 9 needed to have some level of breathing support, with 4 needing to be on the ventilator. So in looking at this group of children and young adult patients, there doesn't seem to be much of a difference between them and older adults. This group had similar numbers of people who needed to be hospitalized or were critically ill. Now, does this change how I think about children and coronavirus? Yes and no. There are several limitations to this study. First, this was a small study looking at patients within a very specific geographic region. Second, these were patients who needed to seek medical attention because of their symptoms. Third, the population studied had a higher representation of African American and Latino patients, which we have seen is a risk factor in adults. For those reasons, it's possible the results don't represent children overall, but rather just the ones they studied. All that being said, this study does give me pause about the generalization that children aren't getting sick from COVID-19. There's still a lot we don't know about coronavirus, and we've seen it affect people in many surprising ways. And in this group, one of the patients had an unexpected phenomenon, which is now being called multisystem inflammatory syndrome, which is what we're going to talk about next. Question 3, what is multisystem inflammatory syndrome? COVID-19 typically causes a pneumonia-like illness, and as we talked about earlier, children tend to have a milder course. However, it seems that an exaggerated immune response may be causing an inflammatory condition that affects multiple organ systems. This condition resembles Kawasaki disease and toxic shock syndrome. We'll go over what those two illnesses are in just a few moments. This phenomenon was first observed in Bergamo, Italy, and has since been seen in New York, New Jersey, Massachusetts, and the United Kingdom. In a study published in The Lancet, doctors compared children who developed Kawasaki-like disease during the COVID-19 pandemic to children who were diagnosed with Kawasaki disease over the previous 5 years. Let's talk about what Kawasaki disease is. Kawasaki is a rare disease caused by inflammation of medium-sized blood vessels throughout the body. The medical term for this is systemic vasculitis. It was first noticed in Japan by Tomisaku Kawasaki, hence the name. In this study, they saw 10 kids with this disease in the span of 1 month. That's compared to an average of 1 kid every 3 months over the past 5 years, which means there were 30 times more cases during the COVID-19 pandemic than before. The classic presenting features of this disease are children with high fevers, bilateral conjunctivitis, or redness and irritation of both eyes, inflammation of the mouth causing swollen lips, and a red tongue, which is known as strawberry tongue, cervical lymphadenopathy, or swelling of the lymph nodes in the neck, rash throughout the body, and redness, swelling, and skin peeling of the hands and feet. The cause of Kawasaki disease isn't known, but the current thinking is that it's triggered by an infection resulting in an autoimmune response in those with a genetic predisposition. This aberrant immune response results in inflammation of medium-sized blood vessels, damaging and weakening their walls. The most important complication of Kawasaki disease is how it affects the heart, and it's actually the most common cause of acquired heart disease in children in the United States and Japan. As we said, there is damaging and weakening of the walls and blood vessels. In particular, the blood vessels of the heart can be affected. These blood vessels are called coronary arteries, and the damage and weakness that occurs can result in ballooning or aneurysms. These aneurysms and inflammation can lead to decreased blood flow, damaging the muscle of the heart. This is called myocardial infarction. Inflammation from Kawasaki disease can also affect the fibrous covering around the heart, known as pericarditis, and the heart muscle itself, known as myocarditis. Nowadays, with early recognition and treatment, the acute symptoms can be alleviated and the risk of coronary artery aneurysms is significantly decreased. The standard treatment is intravenous immunoglobulin, or IVIG, as well as high-dose aspirin. IVIG has many different uses and has been used to treat several autoimmune conditions. There are several differences in what the authors found in these cases of Kawasaki-like illness. It seems that the children had a more severe version of the disease, with 6 out of the 10 developing heart complications. That's compared to just 2 out of 19 before the pandemic. Additionally, 5 out of the 10 children developed signs of toxic shock syndrome, compared to none before. Let's talk about what toxic shock syndrome is. Toxic shock syndrome is a condition where the immune system is hyperactivated, and instead of helping fight off an infection, your immune system starts to cause damage to your own body. Your immune system can recognize unique pieces of bacteria or viruses, which are called antigens. 2 major cells of the immune system that recognize antigens are B cells, which produce antibodies, and T cells, which attack foreign pathogens. One of the major functions of the immune system is to continually monitor for antigens, which are taken up by an antigen-presenting cell, or APCs. APCs will then display the antigen for a T cell to recognize. This recognition and binding causes T cells to become activated. Normally, around 0.1% of all your T cells will become activated during an infection. However, in toxic shock syndrome, T cells become hyperactive. Usually this is caused by bacterial toxins like those made by the bacteria Staphylococcus aureus or Streptococcus pyogenes. The bacterial toxin acts as a superantigen and can activate up to 20% of your body's T cells. COVID-19 is the result of a viral infection, so there's no bacterial toxin superantigen causing hyperactivation of T cells. It's not exactly clear what the mechanism is for hyperactivation, but what is clear is that patients with severe COVID disease have a really exaggerated immune response, with high concentrations of pro-inflammatory cytokines in their blood. The result of this is both hyperactivation of T cells, leading to direct tissue damage, and depletion of those T cells, leading to decreased ability to fight off infection. Toxic shock syndrome can present with fevers, low blood pressure or hypotension, rash and skin peeling, and multiple organ system damage. For example, you can have confusion, kidney failure, liver inflammation, and vomiting or diarrhea. The treatment of toxic shock syndrome is supportive care, including IV fluids, medications to support blood pressure, which are called pressors, and addressing the source of infection. For example, antibiotics or draining an abscess. In the case of COVID, this isn't really possible. We don't have medications that can just get rid of the virus. Another major difference that the doctors noticed is that the children had resistance to the standard IVIG treatment. 8 out of 10 patients required steroids in addition to IVIG to decrease the level of inflammation. That's compared to just 3 out of 19 before. So what's the takeaway from all this? It appears that the overall risk of children getting COVID-19 is low. At the same time, we really don't know that much about children who are getting sick. The studies that we talked about in today's video show us there's a risk for hospitalization or critical illness, especially in infants, adolescents, and young adults. Additionally, the virus is constantly surprising us in how it's affecting people, and the long-term consequences of all this isn't known. We obviously have a lot to learn, and what gives me hope is the everyday dedication of scientists and healthcare professionals all around the world. Thanks for continuing to learn with me as we navigate these uncertain times together. Until next time, stay safe, stay well, and I will see you soon.